Hello, everyone. Welcome to the All Things Celiac webinar series brought to you by the National Celiac Association and the Harvard Medical School Celiac Education and Research Program. Today's webinar is titled Getting the Most from Your Gluten-Free Diet, Adaptations, Budgeting, and Access for All. My name is Chris Rich, and I am the CEO and Executive Director of the National Celiac Association. We here at NCA provide educational resources to our celiac community, such as this All Things Celiac webinar series, and we continue to value the opportunity to work in collaboration with the Harvard Medical School Celiac Education and Research Program to bring such initiatives to you. In addition to our educational programs, the National Celiac Association has an extensive support network that reaches from coast to coast and assists everyone from kids and their families to our celiac seniors. You can find more information about the ways that we support our community on our website at nationalceliac.org. The highly collaborative Harvard Medical School Celiac Education and Research Program was founded in 2013 and has a twofold mission of developing and promoting the latest research in celiac disease and advancing awareness about celiac disease through educational programs to clinicians and the general public. Education is at the heart of the HMS Celiac Education and Research Program, and these webinars continue to feature multidisciplinary speakers with specialized knowledge on celiac disease, related autoimmune conditions, and nutrition. For today's event, you are welcome to ask general questions through the Q&A feature, which is located on the bottom right corner of your Zoom screen. Closed caption is also available by clicking on the CC button. For those of you who have registered for continuing education units, please fill out the survey that will be added to the chat box during the webinar. If you're still struggling to connect with us, tech support is available if needed at digitalmedia@partners.org. That address again is digitalmedia@partners.org, or you can reach us by phone at 857-282-6470. This session is also being recorded and will be available for viewing on the National Celiac Association's website, and that address again is nationalceliac.org. Our moderator today is Vanessa Weisbrod. Vanessa is the Chief Education and Community Engagement Officer at the Celiac Disease Foundation. For nearly 2 decades, Vanessa has been at the forefront of transforming lives through education, community building, and advocacy. She spent nearly 17 years working in celiac disease programs at pediatric hospitals such as Boston Children's Hospital and the Children's National Hospital, and has developed a deep understanding of the intricate challenges faced by pediatric patients and their families. Most recently, Vanessa has served on the executive committee of the Harvard Medical School Celiac Research and Education Program and the Executive Council for the Society for the Study of Celiac Disease. Vanessa hosts monthly Raising Celiac podcast and has authored 4 gluten-free cookbooks. She believes in the power of education to inspire change in the healthcare community, and it is from this perspective that she develops innovative programs, initiatives, and partnerships for both patient families and the medical providers who treat them. So thank you all for being here, and hello, Vanessa.
Thank you so much, Chris, for having me. Thank you to NCA and the Harvard Medical School Education and Research Program for putting on today's webinar. As so many of you know, this topic is very near and dear to my heart and one I've spent many years working on, so I'm thrilled to be here to moderate. To reiterate what Chris has already said, please remember that if you do have questions, to use the Q&A feature and to submit only general questions. There will be no personal medical advice given during today's webinar. This session will be recorded and available later for viewing at nationalceliac.org. As Chris mentioned, there are CEUs available for dietitians, nurses, physicians, and social workers. To receive those credits, you must fill out the survey that will get posted in the chat section during the webinar, so please remember to fill that out. It is now my pleasure to introduce our first speaker. Dr. Soran Bozorg is a GI fellow at the Karolinska University Hospital and a PhD candidate in Epidemiology and Health Economics at Karolinska Institutet in Stockholm, Sweden. He is currently completing a research fellowship at Massachusetts General Hospital, Harvard Medical School. He received his medical training at Karolinska Institutet while simultaneously pursuing a degree in economics from the Stockholm School of Economics. As part of his PhD program, Dr. Bozorg is investigating clinical and health economic outcomes within various gastrointestinal diseases and is currently focusing on celiac disease. His collaborative review on the economic burden of celiac disease on patients in Sweden was recently published in the journal Gastroenterology and will serve as the topic of his presentation today. Welcome, Dr. Bozorg.
Thank you, and thank you very much for that wonderful introduction. I'm very happy to be here and present to you. And let me just share my slides here to get us started. Can you see this correctly?
Looks great.
Great, perfect. Today I'm going to be talking about the economic burden of celiac disease, the high cost of gluten-free food, and beyond. And as Vanessa mentioned, this is based on a recent review that we did for gastroenterology, which I hope will sort of set the stage for the other speakers as well through sharing some insights about the economic impacts of celiac disease. Before I start, these are my disclosures. And then I'm going to just say some couple of sentences about health economics. So why is health economics important and why are we talking about it? Well, as a matter of fact, health economics has become a rapidly growing research field due to its importance of forming health policy and recommendations. In fact, with the rapid scientific advances during the last decades, I would argue that the most limiting factor for health is no longer what we're able to do, what we have the capacity to treat. Instead, the financial limitations that the limited healthcare resources seem to be the greatest challenge to overcome in order to improve health and well-being in society. And this obviously becomes evident when looking at data from OECD, where we can see that the healthcare expenditure per capita has increased by around 140% in the last 20 years. And at the top of this graph, you can see the US without competitors, with the other countries somewhat below. And my own country, Sweden, you can see in blue here. And this increasing healthcare expenditure has certainly put the strain on the healthcare system, which means that we really need to prioritize our resources. A review in gastroenterology recently ranked GI diseases as the top contributor to the annual direct healthcare expenditure in the US, placing at $136 billion above heart disease and mental disease. And while I would be careful to rank these different diseases against each other, I think that this evidence clearly demonstrates that the economic burden of GI diseases is very substantial. So where does celiac disease fit into this? I think many of you would agree with me when I say that there is a general underappreciation of celiac disease, both in general, but also within the medical community. A lot of people I talk with seem to think that as soon as patients get a diagnosis, they need to stay away from gluten, and that's it. Very straightforward. However, in recent times, there's an increasing evidence that the economic burden of celiac disease is actually quite extensive and stretches well beyond the cost of gluten-free food. And that's also one of the main reasons for why we decided to do this review. And before we sort of get into the numbers, I also want to introduce the concept of economic burden, as it depends on which stakeholder perspective you're looking at. And the most central perspective is the patient perspective, which accounts for costs that are out-of-pocket expenditure for the patient. And we've tried to do this figure to sort of illustrate the different stakeholder perspectives from a celiac perspective. And here we can say that from a patient perspective, obviously, there's increased costs of gluten-free food. And this is in a very direct way relevant to individuals and families with celiac disease. However, in addition to that, we also have the healthcare system perspective, which also takes into account the costs for the healthcare system and, above all, healthcare use. So outpatient visits, hospitalizations, but also prescribed medications. And finally, we have the societal perspective, which I believe is often overlooked. And here we also look at costs related to productivity losses, either due to absence from work or reduced productivity at work, namely absentees and presentees. And in children, this translates to school performances. However, I don't think we'll have the time to cover that in this presentation. So before we going on to some numbers, I also want to emphasize something about these outcomes. As I said before, the costs for patients are very directly relevant to patients and their families. However, these other healthcare outcomes are also very important, as they are an indication of the well-being of patients. So in addition to serving as a very important contribution in guiding policy and recommendations, they also allows us to capture the burden of these diseases from another angle. And as I want to illustrate with this figure here is that while some level of healthcare use as part of routine follow-up is clearly favorable, if a certain patient has an increased healthcare use, which is higher than the average, that is typically a signal that that patient is not feeling well. Similarly, if a patient is very sick and not able to go to work, that is also a clear signal that something is not good here. So both these outcomes actually allows us to also capture the reduced well-being of this patient group. Okay, so I'm going to try to present these findings based on these different concepts and perspectives, and we're going to start with the patient perspective, which is going to circulate around the gluten-free food. So I think just based on the title of this webinar, it won't be a surprise to any of you that the cost of gluten-free food is much higher than their counter-containing parts. Here we can see reports from the UK Celiac Report, which shows that this is true across a variety of different food categories, and the average is around 2 times the cost of gluten-containing products. We did a similar compilation in our review, and we found the similar results. So gluten-free products are in general about twice as expensive. In addition, we also compiled data from different countries, and we were able to show that this is actually true for, this is consistent across countries, for all the countries that we looked at least. And you can see that it hovers around 200%, which means that the cost is really twice as high, which is obviously not insignificant to individuals with celiac disease and their families. However, in addition to only the increased costs, I also want to emphasize something else that is not as often talked about, and that is the nutritional composition of gluten-free products. So we know from years of research that a lot of gluten-free products can be lacking some nutrients. Above all, vitamin B and iron has been frequently reported. In addition to that, we've also seen that a lot of gluten-free products are high in fat, salt, and sugar, especially if you compare them to gluten-containing products. And this obviously has very important consequences for the long-term health, as individuals on gluten-free food eating these products can have an increased risk for metabolic disease. As a result of this, there's a lot of dietitians that sort of pushing healthy GF products, as they are generally considered to be much healthier. However, the problem with that is that they are also even more expensive. And obviously, this is something that's true for everybody. In today's society, healthy food is more expensive than unhealthy food. And this is obviously a big problem. However, I think the reason for why I'm pointing this out here is that it becomes even more complex for individuals with celiac disease due to the limited availability of finding gluten-free products that are healthy and also reasonably priced. So this becomes a very intricate problem that could be difficult to overcome. And some patients might need to decide if they should get gluten-free products or healthy products, which is a big problem, of course. And we also tried to look at some of the stipends to improve the access to gluten-free food across different countries. And what we could see here is that, first of all, the financial stipends are very limited. And this was true in all the countries that we investigated. What's striking about this was also that, at least to my knowledge, none of these stipends covered any natural GF products. And that's really what we want individuals to eat, as it's more healthy. So you cannot get any reimbursement for naturally GF products, which is really a shame. And this sort of presents a dilemma to patients that may need to choose. As mentioned before, this dilemma applies to all foods, not only GF foods, and it applies to the whole society, not only individuals with celiac disease. But obviously, this becomes a more complicated dilemma due to the limited options of gluten-free products. And to me, this is clearly a good reason for individuals. There's a good reason for individuals with celiac disease to try and eat healthy, to reduce excess comorbidity and stay healthy. However, it's also a very good indication for the society as a whole to improve the access, as arguably you would be able to have much healthier patients with less use of healthcare and who are fit and healthy enough to go to work. And this could really have very good long-term effects. And going into that and sort of looking at how does this look right now and how does the healthcare cost look right now, we also looked at that. And that sort of leads us to the next theme, which is the healthcare system perspective. And these studies are limited to the US, Sweden, and the UK. And here we could see exactly what we're talking about before, that patients with celiac disease actually have a substantially increased use of healthcare, which could at least partly be explained by unhealthy GF food, but also complications due to not being able to follow gluten-free products due to cost, but also due to other reasons, of course. Based on these studies, we could see that patients or individuals with celiac disease had in the US 2.5 times the cost of the general population, which is very significant if you compare it to other diseases. And a similar number was found in Swedish studies. And this is studies of prevalent celiac disease, which means that we're looking at individuals across all disease stages. So we have newly diagnosed, we have those who have been diagnosed for 5 years, 10 years in a real life proportion. In the UK study, they didn't show any absolute costs and they didn't compare it to a reference group as a general population. So we can't really present a multiple there, but just looking at the number of outpatient visits and hospitalization, it was quite similar to the Swedish data where we also presented those kind of data. So I would say that all of these countries have about the same multiple, so the same relative increase of healthcare use. Further on,
3 minutes, Dr. Bozorg, 3 minutes.
In the Swedish study, we also looked at age differences, and we were able to see that among pediatric patients, they really had the highest costs. Moving on, we also looked at cost over time, and we were able to see that, as expected, patients with celiac disease do have increased costs before diagnosis, which we know is common since a lot of people go undiagnosed for a lot of time. But we were actually surprised that the costs were also increased after diagnosis, and they also seem to be increased in comparison to before diagnosis. So there is something going on there, meaning that we're not able to adhere to gluten-free food or something like that. And the same was found in UK data. We tried to sort of disentangle the relationship between costs and inflammation by looking at mucosal healing, but we were not able to show any difference in terms of mucosal healing among individuals with celiac disease. So instead, we tried to see, okay, what are the drivers of the cost? And consistently in Sweden and the US, we found that outpatient care was the biggest contributor, and that most of the costs were actually attributed to comorbidities. And some studies have suggested diabetes type 2 as one of those comorbidities. Another study in Sweden, we also found that individuals with celiac disease seem to be overrepresented with having psychiatric diseases. And both psychiatric disease and the musculoskeletal diseases seem to be one of the main contributors to these access costs. Moving on to the societal perspective, we basically could see the same trajectories as with healthcare costs. So looking just at lost workdays, we saw that patients with celiac disease had 2.5 times the number of lost workdays as compared with the general population. And to put that in a context, it's similar to ulcerative colitis, but somewhat lower than Crohn's disease, but it is very substantial. And also looking across time, we could see the same trajectory with increased even before diagnosis, but even more increased after diagnosis, which is quite surprising. And as with costs, no difference in relation to mucosal healing. So with this in mind, we really want to point out that the cost of celiac disease is much more than just a gluten-free food, which is certainly not insignificant, but due to the complications and comorbidities, which could be driven by GFD, they also have other costs related to healthcare use and lost workdays. So moving forward, how should we sort of treat this? And I think that what we really want to make an argument for in this study is that we have ample evidence that improving the accessibility of healthy GF food could really make a difference, both for patients, but also for society, as healthier patients with less comorbidities and less complications would also lead to reduced costs in healthcare in the future. And ultimately, I also like to point out at the end of every my session that all of this is sort of to capture the well-being. So by reducing the need for healthcare use and reducing lost workdays, that is really a signal of well-being. And that's really what we aim to do. And by improving that, I think that we can do that. However, that's obviously a long-term goal. And I think there's evidently stuff that you can do right now with the right strategy. And I hope that some of the future speakers in this webinar will help you to sort of navigate the GF food by finding right strategies to also be able to adhere to gluten-free food and especially healthy gluten-free food. Thank you. A bit rushed on this end, but I hope that made sense.
Thank you so much, Dr. Bozorg. So our next speaker is Dr. Lauren Fiechtner. She's an assistant professor of pediatrics at Harvard Medical School and director of the Center for Feeding and Nutrition at Mass General for Children. A board-certified pediatric gastroenterologist, she also serves as senior health and research advisor at the Greater Boston Food Bank. Dr. Fiechtner has extensive experience in epidemiological investigations, neighborhood food environments, social determinants of health, health services research, implementation science, and direction of randomized controlled trials. Her research includes the treatment of childhood obesity in clinic and community settings and the implementation and dissemination of evidence-informed childhood obesity management practices to reduce disparities. At the Greater Boston Food Bank, she is working to improve access to food assistance programs by understanding the prevalence of food insecurity and barriers and facilitators to accessing food pantries and federal assistance programs. Welcome, Dr. Fiechtner.
Thanks so much. I'm excited to be here. I'm going to share my screen. And this actually just came out yesterday in the Boston Globe. So we're excited to present this new data hot off the press from the Greater Boston Food Bank and myself. So my title of my talk is called Hunger and Growth, Addressing Food Insecurity. I have no financial relationships to disclose, but this work is funded by a USDA Reach and Resiliency grant through the Department of Early and Secondary Education in Massachusetts, Vitamix and Ardmore Institute for Health Foundation, and an MGH Claflin Scholars Award. So I'm just going to bring you into my clinic and sort of give you a piece of what I think families are really struggling with now. And this is an example of one of my patients. So JW is a 16-year-old with depression, anxiety, celiac disease, abdominal pain, and constipation. She lives at home with her mother, 3 siblings, and her aunt and uncle. There's a history of domestic violence, and the family recently lost their home due to a fire. She does not participate in regular physical activity, but reports that she will sometimes walk to her job at a fast food chain restaurant. She typically skips breakfast, eats school lunch, and grabs a snack at her job. The family struggles to have food at the end of the month when their SNAP benefits run out. Sleep has been an ongoing problem for JW. She reports that she gets in bed between 10 and 11 p.m., but will often not fall asleep until 2 or 3. During this time, she's lying in bed trying to fall asleep or listening to music. And so our job for JW is really to give her a multidisciplinary approach to achieve healthier habits and lifestyle. But you can imagine in this setting, this can be really, really challenging. And so we began with an in-home peer support mental health counselor that we were able to get in JW's home. School also had this healthy goals within their curriculum to walk 100,000 miles, similar to the song, collectively. And she was very motivated by that, and so began to do that. I will also talk about our on-site food pantry, which is a plant-based pantry, but can tailor to the needs of the celiac population. And so that was really helpful too, because SNAP is just not enough. And she also received help from our sleep clinics. You can see her growth curve there, that she really successfully did decrease her BMI over time with working with us. And so, you know, health disparities, which JW currently was facing, are symptoms of really broader underlying social and economic inequities that reflect structural and systemic barriers and biases across these sectors. And we know that stress from all of these negatively affects health across the lifespan, and that environmental factors may have multi-generational impacts. And so really understanding these inequities can serve as a catalyst for the challenging work required to addressing them. So part of my journey to catalyze change was to join the Greater Boston Food Bank team as their senior health and research advisor 4 years ago, right prior to COVID. And during that time, we were seeing a very high increase, as I'm sure many of you across the country were, of our food pantry use. And I, at that time, reported to our chief operational officer, and she said to me, "How can you help me predict how much longer we're going to need to get all this food out in the system?" And so we created a statewide survey to really monitor our food insecurity rates in Massachusetts, and also to understand barriers and facilitators to accessing the many nutritional programs, to really understand what the needs were and how to really serve our communities better. And so just yesterday, we released our 4th annual Food Equity and Access Report. And this year's theme was Voices and Solutions from Lived Experience, because we really want to hear what we can do from those experiencing food insecurity to improve our state's really high level of food insecurity. So here are some of the voices that we heard this year. And so you can see it's really about the cost of living. And like Soran said, healthy food is really expensive. And so when you don't have enough money to pay for food, that can be really challenging. So you can see this one quote says, "The cost of living is increasing rapidly, and I often have to try to cut costs relating to food to continue to pay for other necessities." And then I think this other quote is really similar to what someone on a gluten-free diet would think too, is that I need to eat specific types of food, which increases my grocery costs significantly. I wish there were increased stipends for those with specific medical issues in regard to necessary food items. And these are just some of the quotes from those on a gluten-free diet who participated in the survey. So a white senior woman who was a SNAP participant in Norfolk County said, in our home, we have diabetic, gluten-free, vegetarian, and dairy-free diets, and someone with a very sensitive stomach. This is why food is so expensive for us. The price of gluten-free foods is criminal. And then another woman from Essex County said, having celiac disease increases the cost of food for me since it has to be gluten-free. Gluten-free foods are more expensive. And then finally, a food pantry and SNAP participant in Worcester County said, gluten-free vegan options are scarce at food pantries. So a little more background about where the survey comes from in our methodology. From November 2023 to March 2024, we conducted an online survey of more than 3,000 adults in Massachusetts. The survey includes quotas for income, gender, race, ethnicity, age, education, and region. And we monitor those closely as we get these responses back to make sure we are hearing from historically unheard voices. After we obtain all the data, we use weighting methods to create estimates representative of the Massachusetts population. And as I mentioned before, our goals were really to elevate the voices of these 3,000 folks across the state with lived expertise of food insecurity and highlight their solutions for solving hunger. We want to decrease inequities in food access by improving experiences with hunger relief organizations and programs. And we continue to evaluate the increased need for nutrition assistance programs and raise awareness of support for and enrollment in these programs. So here you can see the food insecurity rate since we began the survey. And you can see in 2019 and before COVID hit, we estimated that the Massachusetts food insecurity rate was around 19%. After COVID hit, we really saw a sharp increase in food insecurity as was seen across the country, with 30% of our households reporting food insecurity in 2020. That increased to 32% in 2021, and then 33% and then 34% this past year. There continues to be disparities in food insecurity in Massachusetts, and I would suspect also from the USDA data and Feeding America data that we see these inequities across the country, with American Indian, Alaskan Native experiencing the highest rates of food insecurity at 62%, 56% of those identifying as Hispanic were experiencing food insecurity in 2023, and 51% experiencing food insecurity in the Black community compared to 30% in those who identified as white and 26% of those who identified as Asian. We also see very high rates in those identifying as LGBTQ plus at 56%. College students, we have a lot of work going on in the state around college students, but that's very high at 44%. And then seniors at 18% as well. So as a provider, I think it's important to really think about what our patients are making trade-offs on while they are struggling to pay for food. And so of those with food insecurity in the last 12 months in the survey, 69% had to choose between paying for their utilities and paying for food. They also said they had to, a similar percentage, they had to choose between paying for transportation and paying for food. 62% had to choose between paying for a mortgage or rent or food. 55% had to choose between paying for medical care or food, and 39% had to choose between paying for food or school or tuition. Households experiencing food insecurity also use multiple strategies to get enough food. So 86 bought the cheapest food available, even though that often tends to be least nutritious or potentially not gluten-free for those on a celiac or gluten-free diet. 60% receive help from family or friends. 46% had to sell or pawn personal property to afford food. Alarmingly, 45% have to water down food or drinks. And WIC participants had to water down infant formula 44% of the time. This is very alarming to me, as we know that watered down infant formula is not balanced for electrolytes and can lead to electrolyte imbalance and also seizures in these young infants. Also, just a note that lower income households are making more trade-offs when it comes to purchasing food. And in 2022, the USDA found that households in the lowest income quintile spent an average of $5,000 on food annually, which represents 31% of their income, while households in the highest income quintile spent an average of $15,000 on food annually, or 8% of their income. So as I mentioned, this year, our main focus was really to understand solutions, because we're very frustrated here in Massachusetts. It's a small state, but has amazing resources. How do we really get to the solution here? So I'm not next year saying 1 in 3 people in Massachusetts continue to have food insecurity. So we asked food insecure individuals about the barriers they face and the issues they recommend us focusing on in the next year to solving this problem. And the number one issue they wanted us to tackle was high inflation and rising food costs. And then the second one was high cost of rent or buying a home, too many low-wage jobs, job loss or unemployment, and limited transportation options. Also this year, which was new, is we asked how much more money they would need to really solve this problem. And households experiencing food insecurity reported that they really needed just $60 more per week, a difference of about $2,000 a year. And we get that math because the USDA estimates that families are food insecure about 7 to 8 months out of the year. This isn't really that much money when you think about it. A $2,000 raise would really help these households achieve food security. So now I'll look at the community food assistance program use. And I think this is a really great story for Massachusetts on how we really got the word out that food pantries are a place to be trusted. Food pantries are a place where you can get healthy food. And so you can see in 2019, prior to the pandemic, 27% of households with food insecurity were using our food assistance programs across the state. And that increased over the pandemic to 49%, or roughly 1 in 2. You can see in the blue bar that's receiving half or more groceries from a community food assistance program, and that really rose quickly at the beginning of the pandemic. But with all the pandemic benefits like the SNAP increase and changes in the WIC program, we saw that reliance go down. Unfortunately, all those COVID benefits have ended this past year. And so we saw an increase in getting more food from the food pantries. So SNAP, I mentioned in my case as well, that it runs out. And so participation among food insecure households in the state has really risen really rapidly. We've created a common app. So that means when a patient applies for Mass Health, they also they can click a button and say, I would also like to enroll in SNAP. And so we've seen a really high increase in enrollment in our SNAP program, which is awesome. So prior to the pandemic, 25% of households with food insecurity were enrolled in SNAP, and now we're up to 57%. This year, we were also able to ask eligibility criteria, and based on income, our SNAP gap is really small. So we're just estimating 18% of those who are eligible are not receiving SNAP in this past year. And families really love SNAP. They're easy to use. 93% say they're easy to use. They're helpful for their households, but a lot of people have to seek additional food assistance. So 79% need something else besides their SNAP. And then you can see this year, we also asked how long SNAP supported their monthly food budget. And unfortunately, 64% said it covers 2 weeks or less of their food.
3 minutes, Dr. Fiechtner, 3 minutes.
Thank you so much. You can also see that food insecurity rates among children in Massachusetts are quite high, at 36% in 2023 and 35% in 2022. Disparities persist in this population as well. And so what child level food insecurity means that a child went hungry, skipped a meal, or didn't eat for an entire day because the family did not have money for food. We are really lucky in the state of Massachusetts in that we're one of, I think, 8 states now that has approved universal school meals permanently in our budget. And that has really, there's so much good qualitative data that we have that free school meals have really impacted families in such a positive way. And we estimate that families actually save about $1,100 a year by having these free school meals. We also asked a lot more questions about the WICS experience, and overall, they really liked the benefits, but we wanted to also ask for solutions because we saw a little bit less of an uptake in WIC. 60% of those with food insecurity are enrolled in WIC. And so, like I talked about, that solution of having, when people are applying for Medicaid, to be also enrolled in SNAP, that seems to be the next solution for Massachusetts, and having also enrollment in WIC for those that are eligible. The relationship between food insecurity and chronic health conditions is something we've been monitoring the last 2 years. And you can see that for households with food insecurity, hypertension was the #1 chronic medical condition, but food allergy, which we didn't have them specify whether it was celiac or other food allergies, was pretty high at 17%. And just as Soran showed, and I showed you in the qualitative quotes, gluten-free food is really expensive. So that's why and also other food allergen-friendly foods are expensive. So that's why we expect that higher number. But there are amazing things that we've done in Massachusetts, and I want you to take that back to your states as well. We have had an 1115 waiver program, which allows for reimbursable nutrition programs, and that's going to be really expanded in the next year to every eligible ACO participant. We've also had a lot of infrastructure and strengthening for food systems across the state. I mentioned universal school meals. There's also diversity and equity inclusion training we've done across the state. And there's hunger relief programs happening in college campuses. I'll just highlight one last good food pantry is our plant-based food packages and MGH Revere, which are gluten-free as well. And we've shown really impressive BMI reductions for those families receiving this. And so finally, what can you do to improve diet quality and outcomes for those with celiac and food insecurity? I would say screen for social determinants of health. This is an important part of ensuring they have access to healthy and gluten-free foods, and connect the family to WIC, SNAP, school meals, and local food pantries. And if possible, connect to other resources for housing, utilities, and childcare. Thank you so much.
Thank you so much, Dr. Fiechtner. That was really interesting. So our next speaker is Carla Carter. She is the Director of Outreach and Programming with the National Celiac Association. She was diagnosed with celiac disease over 2 decades ago while completing her Bachelor's of Science in Occupational Therapy from the University of New Hampshire. She worked for over 15 years in the clinical setting, treating adults and seniors with diverse medical diagnoses, specializing in neurology, specifically Parkinson's disease and stroke recovery. Carla transitioned to working at NCA in 2017, where, among other things, she oversees the development and running of the organization's programs, including Feeding Gluten-Free, which improves access to gluten-free food for people around the nation experiencing food insecurity. Welcome, Carla.
Thank you so much, Vanessa. I really appreciate it, and I appreciate everyone else here. Just going to start my slides. Sorry, one moment. Okay, here we go. Okay, so as Vanessa said, thank you very much everyone for being here, and I was going to cover adaptive strategies today to maximize your budget on the gluten-free diet. Here are my disclosures. And my goals for today for everyone. I wanted to first recognize that we're all here for a different reason. Many of you have celiac disease like myself, and until a different treatment or cure comes, we have to eat the gluten-free diet for quite some time. So for anybody eating the gluten-free diet, I'd love for you to be able to identify at least 3 strategies from today that you can put into place to lower your grocery budget, or to find supportive services. If you are a clinician on here today, we really appreciate you being on here, and I'd love for you to be able to familiarize yourself with some of these resources and feel empowered to refer people to those supportive services. And some of these slides will be available as a handout for you to refer to when the recording becomes available. Just a brief background. As Vanessa said, I was diagnosed with celiac disease for over 20 years ago now when I was a college student with a very thin wallet. So I've personally used a lot of these strategies today, and we continue to use them in our own family. We're a family of 4, and 2 of us have celiac disease. Additionally, we use these strategies to help people around the nation through our Feeding Gluten-Free program, which coordinates the donations of gluten-free food to food banks and pantries nationwide, as well as pays for shipping and gluten-free food to those organizations. We also educate individuals and those food assistance organizations on celiac disease and managing with the gluten-free diet. And we also advocate on local and national levels for improved access to gluten-free food. So a brief look at the numbers. I know our previous speakers did a fabulous job reviewing them all. But just a couple of the studies, there are definitely more out there, but we know that 1 in 6 people face food insecurity in the United States. But less than a quarter of those people are able to adhere to the gluten-free diet. And as Dr. Bozorg said, the diet is more expensive, approximately 183% more expensive. And the perceived burden of celiac disease and the gluten-free diet is second only to end-stage renal disease, where the cost of food and meal prep time were both factors. And lastly, people with lower incomes do have greater symptoms of celiac disease and worsened related health. A brief look at our numbers through NCA, through our Feeding Gluten-Free program. Approximately 34% of the people who have reached out to us have needed help feeding their child or children. 10% were physically disabled, and 6% were seniors. So we're definitely seeing people, who are more at risk. When gluten-free food is identified or introduced at pantries, we often find that the need frequently increases, which may show that people might just not know how to access gluten-free food at their local food pantries or food banks. Most importantly, let's consider life's situations. I know there were some really great examples in Dr. Fiechtner's presentation. It's really, I want to respect that every situation is unique. And this first quote is, "What do I do when my food stamps run out?" There was a gentleman who had gone to the ER, and the ER physician recommended a gluten-free diet without a diagnosis for this individual, and he was completely lost. He didn't know what to do, and he didn't have any more money. And so we provided some education there for him and recommended going back to the healthcare system. A lot of people are living just on the edge, not qualifying for any help. This person in Virginia made $22 just too much to qualify for any help. A lot of people are in temporary situations. This person's car broke down and they couldn't afford to fix it, which meant they couldn't get to work or get to a pantry. Many people are working 2 to 3 jobs, and they can't get, and just to get by, and the pantry is never open when they could get there. And a lot of people are too sick from celiac disease to be able to work, which is also reflective in Dr. Bozorg's presentation. So nothing is impossible. I just want to throw this approach out there. As an occupational therapist, we have a unique mindset. We're constantly looking to compensate and adapt what we do and how we act with our environment for optimum health and success. We literally work on skills for the job of living. So I want to recognize again that one person's circumstances, abilities, and access is unique compared with another's. And in many cases, and hopefully most cases, there are solutions. So we're going to jump right in and talk about what your foundation is. Yes, we want to, think of it in a positive outlook. We know the gluten-free diet can be more expensive for sure. Sometimes it can seem impossible. But what can we do to think about what might be possible? And you don't have to replicate all gluten-containing items. Perhaps talk with your family or just with yourself about what are the priorities. There was a gentleman in Virginia, he was a disabled veteran, and he just wanted a peanut butter and jelly sandwich. Your child, if you have a child and they want that cookie, yes, it's not the healthiest thing, but they, for their mental health, want it to be just like their friends. So talk about what the priorities are in your family. And many of us weren't given basic education about financial management. There are a lot of free online tools to work on budgeting. And so really you want to think about what that foundation is with your mindset and how much of a budget you are working with. So let's get right in. Before you go to the grocery store, we're going to start with that. Meal planning. Meal planning means that you're less impulsive. You're less likely to spend money on fast food or restaurants. So meal planning is very helpful if you have the time. Visit myplate.gov for some great meal planning tools. And we have talked about naturally gluten-free foods. They can be more expensive, but we know that the supplemented specialized gluten-free foods are definitely more expensive. So try again, work with your family on what the priorities are. Make your list. These 2 points here on the bottom, make your list as you go through the week or look while you're looking at the sales circular. And there's some really cool apps and websites out there that will spit out a recipe for you if you put in the 3 to 4 ingredients you have in your cupboard. So, work with multiple resources and figuring out what your budget is for that week or every week. Don't forget about coupons, okay? That's an oldie but goodie. There are still print coupons available. Check newspaper inserts. Go online and sign up for newsletters. Call manufacturers. Buying in season for your fruits and vegetables can make them less expensive. So yes, we know that sometimes naturally gluten-free foods, like your fruits and veggies, are more expensive, but when bought in season, they can decrease in the price. Frozen fruits and vegetables are still nutrition-packed, can also be less expensive. And here's a website for some healthy gluten-free meal and snack ideas. So once you're at the grocery store, shop the perimeter for those naturally gluten-free foods. And sometimes grocery stores will have a clearance rack at the back. I like to say ugly is the new pretty. I will get sometimes those items from the clearance, gluten-free produce. You can freeze it at home. You can throw it in smoothies, add it into breads or other baked items. We'll get some zucchini or carrots and shred it and put it in meatloaf cupcakes and then throw those in the freezer. Buying in bulk, usually the more you buy, the less expensive it can be. And I realize you need the space and the budget to do that. And just one note for safety, avoid the bulk bins at the grocery store because of the risk of cross-contact with gluten. Gluten-free items can be throughout the store and not just in the gluten-free aisle. Sometimes they're more costly in the gluten-free aisles. Check for store brand products. A lot of stores have their own gluten-free labeled products and they're privately labeled and they tend to be less expensive. Check the unit price. Shelf tags show the total price versus the price per unit right off to the left. And sometimes a different brand or size is still gluten-free, but might be a better value or a lower cost. My favorite, shop around. If you do have the gas money and are able to get to multiple stores, there are a ton of budget or discount stores that have an assortment of gluten-free products. Just check those Best By dates and always throw them in the freezer at home if you have space. All right, moving on to working in your kitchen. Prepare when you have time. If you work on the weekends, prepare during the week. That prep time will really save you time and money. Excuse me. Your freezer is your best friend. As I mentioned, I've mentioned the freezer several times already, and that will allow you to save time and money. Bread ends, getting really specific now. Nobody likes the bread ends in our house. So what I do is put them in a bag, save them for later, and then I toast them and crumble them up for breadcrumbs. And a lot of that's really trying to use that bread and push it as far as you can. If you don't have access to things like gluten-free flour or gluten-free bread, there are a lot of alternatives. We know a great recipe, chickpea sweet curry, and peas and the sweet potatoes for a nice thick curry. If you don't have that gluten-free bread, butter, lettuce, collard greens, gluten-free wraps. There's a lot of things you can try to be creative with. And if you do have the resources for a pressure cooker or a food processor in your home, that can definitely allow you to make more from scratch and can save you time. Be creative in your swaps. If you love those pretzels as gluten-free pretzels as your snack, but you also like popcorn, popcorn's going to be less expensive. So think about switching some of those. How far can you stretch an item? I don't know about you, but we do like, I'm sorry if you're vegetarian or vegan, we do like a roasted chicken. But then the next day, if you save what's left over and boil it, you can make your own broth for chicken soup, which can go longer throughout the week. And if there's extra broth, you can always freeze it in ice cube trays. The next couple, adapt your recipes, find economical recipes or cookbooks online. We have a cookbook, Thrifty Gluten-Free. There are a ton of budget websites out there, and you can frequently save money that way. Growing your own, I know it's the perfect season for growing your own food. If you don't have room for a garden, you can even do something on your windowsill in the kitchen to grow your own herbs. And some libraries even, just to let you know, will be able to offer free seeds for the community. And don't forget to think internationally. A lot of different types of cuisines, such as South American or Indian, have naturally gluten-free recipes and whatnot, and tend to be less expensive with the ingredients. Community supports and programs. We've been talking a lot about food banks and pantries, and here are a lot of different websites to access those in your area of the country. If you can't find one, reach out to your town hall or churches to see what they might know of for supports in your area. And a lot of us go straight to thinking about specialized gluten-free items and do they have those? But remember, we want to try and think about what is possible. Try to think outside the box. Do they have the naturally gluten-free items like fresh produce, meat, or dairy? And if they don't have those items, do they have non-food items? Do they have paper towels or toilet paper or other hygiene products so that saves you money in your budget when going to the grocery store? Other community supports and programs. There are things such as mini free pantries and fridges that the community stocks those, and they can have some naturally gluten-free items. There are maps to see what's in your area on the websites on the bottom. Food rescue organizations, there's a national one called Flash Food that partners with grocery stores to save food and sell it at a lower cost. And there's a ton of other local food rescue organizations that work directly with pantries. So you could encourage your pantry to find one of those if available. Tax deductions for gluten-free food is a little bit complicated, but still definitely a possibility. Check our website on the bottom of this page for more details about how to do that. Some medical nutrition drinks, like high-protein shakes, are covered by Medicaid, so state insurance and WIC benefits. And libraries, I mentioned libraries again. They have some money management tools, job finding resources, so there's a ton of free support at your local library. Moving on for a brief minute to SNAP benefits. They've been mentioned a lot so far on here. Thank you, Dr. Fiechtner. They cover many naturally gluten-free items as well, and you can use them in grocery stores, some farmers markets. And in a lot of states, there are different programs that will offer a dollar-for-dollar match up to a certain amount of money on fruits and vegetables to use at qualifying farmers markets. So you can really stretch your SNAP benefits there. And they are piloting a program to shop online with your SNAP benefits in some states. And for those of you, if you are on the brink of not being able to qualify for any services, you might want to look at additional funding and your medical expenses. For more information about maximizing your benefit, you can visit this website here. maybe talk to a SNAP program benefit manager or social worker. And just announced yesterday, there's a new summer EBT program for families with eligible, I can't say that word today, children. It's called Sunbucks, and it's 3 different ways to increase financial access during the summer months, as well as direct food access. And I'm hoping some of that will be naturally gluten-free foods, but we'll find out more about that. And lastly, I'm going to move this. There's SNAP eligibility requirements there. Moving on to WIC program benefits. Nationally, the USDA...
Carla, 2 minutes. 2 minutes, Carla.
Thank you. The USDA estimates that only about half of eligible women, infants, and children participate in the WIC program. So check the requirements there to see if you qualify. And they do cover a lot of naturally gluten-free items listed here. And there's an additional small stipend for Farmers and Market Nutrition program, and you can receive a little bit of extra money for approved farmers markets. WIC offers nutrition, education, and counseling, and there's a list of contexts by state. And the new WIC package benefits were announced this year, which will be released in 2026 or effective in 2026, excuse me. Success and progress. I'm going to just wrap it up a little bit. I'm sure many of you have already used some of these strategies, but hopefully there were a couple of them in there that you can definitely use again. You know, in Virginia, there was no gluten-free food at this particular pantry, and we were working with this woman, but that pantry could offer a gift card for that woman to go shop at the store. We're working with a lot of support networks around the nation who are doing gluten-free food drives and working with their pantries. In North Carolina, just a couple of weeks ago, this woman was having difficulty affording food and finding access. We were able to connect her with her library. She was able to obtain seeds, and we were able to connect her with coupons as well as other strategies. And we continue to engage with the White House on their strategy to end hunger and improve nutrition and health. And just the takeaway points, don't forget, try to embrace what might be possible. We know that life can throw some really interesting challenges our way. So try to use multiple adaptive strategies. Think about your mindset in using those strategies and other resources. And for clinicians, don't forget a proper diagnosis is important because of the burden of the disease and diet, and connect those people with supportive resources as needed. Thank you so much for your time.
Thank you so much, Carla. And to all of our speakers, it would now be wonderful if all of our speakers could come back to the screen, and we will get started with our Q&A for today. So I think one of the big problems in the celiac disease community is simply getting physicians to screen for food insecurity. What advice do you have for clinicians who are listening to this webinar on screening patients in their celiac clinics?
So the Hunger Vital Signs is a simple screener. It's just 2 items created by Boston Medical Center and the Children's Health Watch Group. And so that is the easiest way to do it. Doing it in my own specialty clinic, it's harder, it's always harder to do these things than what I say is just ask these 2 questions. And we used to have a practice manager who would send them out pre-visit, and we would get them, and that was awesome. But oftentimes in specialty clinics, those are not put in as they are in primary care because it is mandated in primary care. So my suggestion actually is, if you don't have time, you don't have staff, just say, gosh, groceries have gotten really expensive. Is your family finding they have enough money to get the foods they need? And often people will open up then and want more resources. So I think even just having a conversation can be helpful.
So speaking of the resources, a lot of health providers choose not to screen for food insecurity because they feel like they don't have the right resources to offer patients if they screen positive. What would you consider a minimum set of resources that a provider who sees celiac patients should be ready to hand their patient should they screen positive?
Carla, do you want, I can answer that, but else I feel Carla can too. I mean, I think local food pantries are great. You can go on the Feeding America website and find a food pantry near you. That's one option. SNAP is a nationally eligible, you can be nationally eligible for that. And there's easy enough ways to apply online, or even most food banks will have a SNAP outreach team member who can help you. And then WIC is also something that's available. So I think finding some things in the community and just being willing to spend a couple minutes to search online with that family and give them some resources can be helpful. But Carla, you also spoke to this so well, so go ahead too.
And I plan to, like I said, make a lot of my slides available as handouts, and perhaps turn into a guide that's easily accessible. And don't forget your interdisciplinary team, really connecting with the social worker and other members of the team to see if you can create your own internal guide of strict, straight go-tos. So I would suggest those couple of things.
Great. So let's turn it around. For the patients who are listening today who might be struggling with paying for gluten-free food, who is the person that they should talk to? Should they start with their primary care provider, their gastroenterologist, a community-based group? Where should they go first?
I mean, a lot of people come directly to us. They really should get in with a social worker as best as they can. I know there are SNAP program benefit managers and WIC benefit managers. I know the process can be difficult for filling out forms, so really having someone there to help you is important. And direct some of those other direct resources. Dr. Fiechtner, do you have any other thoughts?
Well, the nice thing is that some of these 1115 waivers across the country means that food is being provided to families. So I would reach out to the primary care provider, or if you are part of an affordable care organization or an ACO, a lot of them will have some food programs. There's also, people did grocery gift cards. Schools have a lot of resources too. So I think definitely ask, and don't be shy. With 1 in 3 people experiencing food insecurity in Massachusetts, I suspect there's much higher numbers across the other parts of the country too. And so, because we have universal school meals and other programs here in Massachusetts, so I would not be shy about this. We all know the increased cost of groceries has affected all of us. And so ask for support. No one should have to go hungry.
Absolutely. So there have now been multiple studies showing that patients with celiac disease who screen positive for food insecurity actually report income levels that are slightly too high to qualify for benefits from SNAP or WIC. How do we help these families?
Soran, do you want? I don't know who wants to take this.
Well, I did mention the one piece of really going over like medical deductions if they qualify for more. It is really tough to hear, right? That one woman made $22 too much. And so I'm not an expert at that. I think really looking towards the professionals who work within that system to see if they do qualify. And there was that link for maximizing your SNAP benefits.
In states like Massachusetts with universal school meals, are they required to provide a gluten-free meal for a child with celiac disease or a child with a food allergy?
Yes, that is. If you have a 504 plan, you have to provide what the child needs for sure. So, yes.
Great. Lauren, can you talk to us a little bit about how the Boston Food Bank approaches patients with dietary restrictions? And do you have any examples that you can share of food pantries doing a really good job of providing gluten-free food to patients with celiac disease?
Yeah, so I know the map was in Carla's presentation from the National Celiac Association, and I searched through it, and there's actually multiple member agencies in Massachusetts. So we're one of the largest food banks. We serve 190 towns and 600 distribution sites. But our agencies are really the heart of this. And so they can really source, as Carla mentioned, they can source foods from local retailers, the Gluten-Free options that are available. So we get donations from all sorts of retailers across the Commonwealth, which is great. So that means that the food bank will work with, let's say, a local supermarket and have the items that they may not sell in time to the food pantry. And expiration dates, I'll just say, are suggestions. They are not necessarily food safety issues. And so all food pantries go through food safety certification. So I see that on the survey often, like, why do they give me expired foods? But in truth, it's a suggestion date, and it's okay to continue to eat those after. So that's called enabling, when a food moves from a grocery store directly to a food pantry. And so I think encouraging food pantries to work with their local grocer to get those specialty items especially is really, really important. I saw Open Doors on there. They do actually the mass health waiver work. They actually have a dietitian on staff that can give counseling as well. We also have dietitians and trainings for our food pantry staff so that they can come on and do that on a website and learn about the gluten-free diet. Finally, I'll just say the reason I'm at the food bank as a physician is that the nutritious foods they do distribute are whole foods, right? And are healthy for everyone. So we distribute more than 40% produce. I think when people think of a food pantry, you think of canned food, and this is not canned food. It's largely produce and brown rice and beans and things that are all naturally gluten-free. Anything I missed, guys? Okay.
So there's a question from someone interested in hosting gluten-free food drives at their local food pantry. What is the best way to go about doing this?
I think being really clear with the food pantry and the people who are donating food what you want, because sometimes the food pantry drives end up just giving people like junk food, right? I just told you how much we make sure from the food bank, which is like a distribution warehouse, to the local food pantry, that we really prioritize nutrition. And so what I see when we have like school food pantry donations, et cetera, it can tend to be more processed food. So just thinking really clearly and having specific items that you want donated there is helpful. Also, I will say food pantry staff know their clients incredibly well, and they know what foods they want. So having a little survey at the food pantry could be really helpful too. Anything else, Carla, you have to add?
I guess just making sure that you contact the pantry who you want to donate it to first, to make sure they're able to identify the people in the community who need the food. And as you know, so if they have the bandwidth as well to be able to accept that food and make sure the people get it who need it.
Great. So there's a question from someone who has a mildly disabled relative who has celiac disease, and they help with food planning. And this individual is a vegetarian. Where is a good place to find gluten-free and vegetarian recipes that can be frozen?
There's a ton of recipes. There are celiac related gluten-free vegetarian cookbooks that exist. We have an entire recipe section on our website. 2:15. Some of them are vegetarian and vegan. So yeah, there's a lot of myplate.gov has that meal planning tool, like I mentioned, and you would want to replace any gluten-containing grains with gluten-free counterparts, and as well as that protein source. Anybody else have any suggestions?
All right, so Soran, I want to have you leave us with something to think about here. So what countries would you say offer the best models for providing food for patients with celiac disease, and what can the rest of us learn from them?
Did you say stipends or like food reimbursements,
or
care in general?
Any of the above.
I think that, truth be told, I think that like it varies across countries as well. At least that's what I hear from the US. There's certainly differences. I think in general, I'm not sure if I have a ideal country to learn from. I think there's different things, but I think that the role of dietitians in sort of helping to guide these, and also sort of applying and learning some of these strategies that Carla talked about, would certainly be a great benefit, and that is underused today. Yeah, I think so. Increased dietitian support and help with these kind of questions would certainly be a lot of help. At least that's my impression. And also, of course, have a better contact with some other disciplinary physicians regarding some comorbidities. We talked about lost work days and stuff like that. And I know that patients with celiac disease have an increased risk for example, anxiety and stuff like that, which could be related to food insecurity and other things. And to sort of have that in the back of your mind and facilitate any contact with other healthcare professionals would certainly be beneficial, I think.
Absolutely. Well, we are a little bit past time already, so thank you so much to all of the speakers, and Chris Rich will lead us out today.
Well, thank you, Vanessa, and thank you to all of our presenters and attendees for your participation. We hope that all in attendance found this webinar educational and helpful. Remember, for those of you who have registered for continuing education units, go to the link sent in the chat box and fill out the survey. Please watch for announcements about our next edition of the National Celiac Association Harvard Medical School Celiac Education and Research Program webinar series, which will continue later this year. You can visit our websites and watch our social media accounts for updates. From all of us here, we look forward to seeing you next time, and thank you for your continued support.